Hi, I'm Susan Zief, a senior researcher at Mathematica and project director for the Office of Population Affairs, or OPA's, evaluation of the Pregnancy Assistance Fund. The evaluation began 7 years ago in 2013 and is ending this year in 2020. I've been honored to lead this effort to learn how grantees structure their multifaceted programs to support the multitude of needs of expectant and parenting teens and their families. We collected data from grantees that allowed us to describe their program plans in depth, to facilitate cross-grantee learning and support their continuous quality improvement efforts. We also evaluated the effectiveness of 3 very different approaches for serving teen mothers, and we conducted a systematic review of all available high-quality evidence to be able to share the collective knowledge in this small but growing field. Now it's time to share what we have learned and how that contributes to the knowledge base. To do so, we are releasing a special supplement with the Maternal and Child Health Journal. The supplement will contain 20 articles written by the grantees, by the funder, OPA, and my Mathematica colleagues, representing a diversity of perspectives and programmatic approaches. In addition to the supplement, I will interview leaders in this field, OPA staff, developers and providers, researchers, and program advocates, to gather their perspectives on the contribution of the supplement and what more we need to learn. But first, I'd like to introduce my colleague, Jessica Harding, who worked closely with the authors and the journal to accumulate this much-needed evidence. Jessica, can you tell us more about the supplement?
In the supplement, we really wanted to draw together the perspectives of researchers and practitioners to share what was learned from 10 years of implementing the Pregnancy Assistance Fund program and really learning about how to support teen parents. So we have 3 articles from the Office of Population Affairs staff who manage the program and can really share about their successes. We have about an equal number of articles from grantees and from Mathematica staff. So the grantee articles really share lessons learned around issues like recruiting and engaging teen fathers, how to plan for sustainability, and there's often so much practice wisdom that doesn't get shared, especially in academic journals. So we really wanted to highlight those perspectives. And then on the Mathematica side, we have a lot of examples of high quality implementation and effectiveness studies that can really tell the field more about what's effective for teen parents. So I would say that the contributions of the journal fall into 3 areas. The first was what's effective for teen parents. And we learned that there were a lot of programs that could improve teens' education and support their healthy birth spacing. But there was no one-size-fits-all approach for those programs. Some were implemented in homes, some were implemented in communities, some were in education settings, both schools, high schools, and higher education settings. And they used a range of different approaches: home visiting, case management, community collaboration. So there's no one-size-fits-all approach to serving teen parents. Then we learned about a whole range of lessons learned from grantees around how to really support teen parents. One area was the importance of partnerships. Teen parents often have a range of needs. They might need support getting healthcare and childcare. They might need support learning about healthy birth spacing and where to access contraception. They might need access to financial resources, help finishing school. And so it's really difficult for one organization to meet all those needs. And often partnerships are really important for meeting those needs. The second area of lessons was around the importance of flexibility in implementation, the importance of adjusting to community context and teens' needs, while also ensuring that programs have a set of core components that are held to. We learned about the importance of staff, of hiring and training staff. Often staff need much more training than programs expected, especially when they were implementing new programs. Grantees also shared a lot of really helpful strategies for recruiting and engaging teen parents, especially young fathers who might not be connected to services and may be difficult to identify. And finally, grantees shared the importance of planning for sustainability from the very start of a program. And the third bucket of contributions was around how to study teen parents. We saw some really innovative methods around using social network analysis to understand the community connections and using administrative data to study teen parents in a low-cost way.
Thank you, Jess. That was such a great introduction to the journal supplement. And next, I am joined by Amy and Molsumi from the Office of Population Affairs. We've worked with them tirelessly over 7 years to understand and learn from the Pregnancy Assistance Fund grant program.